Meet Mark, a healthy 30-year-old. But beneath the surface, trouble is brewing. Poor brushing allows plaque to build up. Here, bacteria multiply rapidly, causing the gums to become inflamed. Over time, plaque hardens into tartar. Brushing can now cause the gums to bleed. Pockets form as gums pull away from teeth, causes persistent bad breath. Bacteria now dive even deeper below the gum line. The infection progresses deeper below the gums. Supporting bone is lost, and the gum line recedes. Fibers holding the tooth are destroyed. This causes the tooth to become loose. A probe checks the pocket depth. Ultrasonic scaling fractures the hardened tartar. The bacteria are flushed away completely. The swelling reduces as the teeth are now significantly cleaner. With proper care, your gums can return to a healthy state. Brush gently in circular motions. Floss daily to remove plaque between teeth, and schedule regular dental checkups.
Taking care of your teeth doesn't have to be hard. Follow our page for easy daily tips.